All right. So this one, I want you to follow these 5 steps. Okay. Number one, okay, you're already doing it. That's why I think I haven't mentioned it too much because you're actually following my steps pretty well. But number one, I want you to read the question first. Number two, I want you to glance at the answer choices and come up with a topic, right? So, you read the answer choices like, oh, is this a respiratory? Is this hemonc? Is this cardio, right? Number three, I want you to read the case, which you have been doing well, but also think in your mind, you want to highlight things that are of clinical significance, which is what I'm highlighting when I'm doing questions with you. Number four, I want you to look at, lab values, right? Or radiology, right? And sometimes there's not that, right? But if it's a lab, like if they're lab values, I want you to highlight every lab that's off because it gives you more evidence to work with. If it's radiology or imaging or histology, things like that, I want you to look at the most obvious thing. It's usually in the center. The center of the image is usually what I say to my students on a test taking strategy. And then number five, I want you to read the answer choices and pick your gut answer choice. And then ask yourself, do you want to keep it or change it? Okay, this one takes a little bit of practice and is a little bit tougher to do. Okay, keep/change. And I always want to tell you that you never want to change your gut answer choice unless you're 100% sure, right, that there's another piece of evidence that's correct, right? So what does that mean? So let's say you're like, oh, my gut answer choice is radiation therapy. And then you're like, oh, maybe I read somewhere weird that it could be chemo. That's not a good enough reason. You have to be like, oh, yeah, I remember in first aid, they mentioned this discrete fact that I remember. So it has to be chemo. So I'm okay with changing. Okay. Does that make sense?
Yeah.
All right. So let's work through kind of this question together here.
Okay, so which of the following is the most appropriate treatment for the orchiectomy? There's chemotherapy, radiation, hospital, further treatment. Okay. So a 32-year-old man presents with a painless enlargement of his right testicle over the past 3 months. On physical examination, the right testicle is firm and non-tender. The tumor markers are elevated LDH, alkaline phosphatase, and normal levels of alpha fetoprotein and ACG. The orchectomy is performed, and examination reveals a homogeneous mass consisting of large cells with clear cytoplasm and essentially local nuclei. The mass is surrounded by 5 receptor-containing lymphocytic infiltrate. Which of the following is the most appropriate treatment following? Oh, wow. Okay. Um, so I'm trying to figure out train the logic here. Um,
So I would say this question is a little bit, I sprinkled a little bit these in to kind of force you guys to think clinically. Of course, this is more of a, how do I say, it's a step two question, I would say, a little bit more difficult. But the way I want you to traverse through these questions is with all questions, not just this question, but you got to always think to yourself, what's the diagnosis, right? As best as you can, even if it's wrong that
the
you chose. So think about the diagnosis and then
Seminoma?
to
Is it
treat.
is it a seminoma?
It could be in my mind, right? I can't, to be honest, I am not 100% sure. My lack of testicular neoplasms now is not as good as it was before. But in my mind, I'm thinking that it's some kind of malignant, right? I mean, I know this is a little bit of a cop out, right? Malignant, right? I think this is a malignant testicular cancer. Okay, that could be, I mean, that could be a bunch of histology, right? Obviously, the histology they give you is large, clear cellular central loci nuclei. The
I
mass is
think
already surrounded by lymphocytic infiltrate, right? So I know it's bad, right? So in my mind, I know this is not good.
that's interesting how you process. Well, so like the clear cytoplasm, I agree that would tell you malignant. And then when I read 5 receptor containing lymphocytic infiltrate, I was like, I don't know that fact. So then I didn't know if I could get the answer correct without knowing that fact.
So, okay, so here on a test taking strategy, let's talk about test taking. Okay, I always say on a question, if you don't know it, you cannot use it. Okay. So what does that mean? If you don't know it, let's say you read something, you're like, I have no idea. Like for me, I'm giving you personally when I'm reading this, right? An orchiectomy just means you take out the testicle. At least I know that. I know that they have increased lactate and increased, this placental alkaline phosphatase, which to me, in my mind, that means like some kind of malignancy or mass of the testicle, right? And then they do a histopathological, meaning, you're doing the pathological examination showing this, right? Homogeneous mass consisting of large cells, clear cytoplasm, centrum locally nuclear. Mass also is fibrous septate containing lymphocytic infiltrate. I'm like, I don't know what that belongs to, right? So in my mind, that doesn't exist because I can't use it, right? So now the question is, okay, so now what I want to do next, right? So I have two ways of thinking. If I think this is benign, what do you want to do? Probably nothing, right? You know what I'm trying to say?
Yeah, yeah. When it's malignant, I don't know, and I don't know if this is because it's step two or not. When something's malignant, I don't know if it's better to just like remove the lymph node or if you're doing some kind of chemo or radiation. I don't know if
Yeah,
that.
no, for sure. I'm in the same boat as you, right? So this question is completely like, completely difficult for me and you, I would say, right? So on these questions, then you kind of now you like, I'm trying to get you to realize like, I don't know the answer to this either, right? And so when you go through this, my main goal when I'm working through questions similar like this, of course, this is more of a step two question. It's a little bit unfair for your exam, right? So my thing is, okay, what can I use from the question, right? So is this malignant, benign? Okay, so figure out which one I want to do, right? So in my mind, it seems more malignant because of the symptoms, right? Painless enlargement of the right testicle, right? It's firm, non-tender, has all these hormones that's secreting, right? The pathology I don't know. So then my question, okay, so out of these answer choices, what do you think I should do? I'm not 100% sure, but you can then make a guess that probably it's not no further treatment, right? That's in my mind. So now I have a 25% of getting it right, right? And so now we just pick and learn from it. Getting it right all the time is not the correct, like, is not the, how do I say this? It's not, when you're studying, it's not really the main focus. If you're stuck here, then you go, okay, let me pick an answer choice and read the explanation and learn from it. So what do you want to go with?
Um, I don't think it's D or E. I think it's either A, B, C.
Okay.
Um, I'm thinking I'm just gonna assume it's a seminoma related thing, which would be chemo radiation, and I'm gonna go with chemotherapy. Chemotherapy, sure.
Okay, sure. All right, perfect. So you got it right. So let's look at this, right? Um, Cytoplastic located with a symphytic consisting of a seminoma. Good job. So to me, you've extracted the most that you can get from it, the diagnosis, right? Because the next things is very difficult, right? So standard treatment of seminoma is chemotherapy, usually cisplatin or this, right? This is like too much for step one. But the main thing is they're going to ask you, did you know it was a seminoma, right? And so you got the diagnosis right. And this is even a harder question than your test. But does it make sense how you kind of work through it?
So I guess what was your last piece of advice? Like, obviously you might not know it, but like, let's say I got down between A, B, C, and then from there you just stick to what you know, and then kind of what would you do from there to like just kind of finish the question?
Yeah, for sure. So stick with what you know, right? I mean, like I said, I didn't know the path. Maybe you did, right? I mean, you sounded pretty confident with the path, right? So I'm good. You're good with seminoma. You got the diagnosis, right? To me, I was like, has to be malignant. I didn't even get to seminoma, right? So then when you get down to, let's say, one, two, and three, right? You just pick your gut, whatever that is. It sometimes is kind of a feeling, right? It's not really supported by anything. You're like, oh, maybe it's chemo. Okay. So you pick chemo and you move on the real test. On these kind of questions, I always say this on these questions where you're like, okay, so it's between these three answer choices, you don't want to spend a lot of time. Does it make sense? You
Okay.
want to say, pick an answer and move forward because you could sit here for 5 to 10 minutes and still not get it right. The odds of it getting is 33%. You know what I'm trying to say?
Yeah, no, I think it's important knowing like what to do in these situations because like I feel like what happens where I get stuck.
Yeah,
So
for sure. Which is why I'm always very like apparent with you guys. I'm like, I don't know this answer, right? But let's work through it together, right? What gives us the best chance of getting it right? Let's pick an answer and then move forward. Because that's the same thing when you're doing these practice questions too. You want to think about it, but when you know you're definitively stuck, are you going to spend 20 minutes on this question? Is your question is like the real test taking strategy, right? Your real answer is once you've got it to 33%, that's your best shot. So pick an answer, pick your gut, and then move forward and learn from it. Okay.